In this module, we're focusing on the enrollment rules for Medicare Advantage and Part D prescription drug plans. By the end of this section, you'll have a full understanding of when beneficiaries can enroll, who is allowed to help them with the enrollment process, what happens after enrollment, and how disenrollment works. We begin with the simple question: when can someone enroll in a Medicare Advantage plan or a Part D prescription drug plan? Enrollment opportunities are controlled by specific timeframes called enrollment periods. These periods include the Initial Enrollment Period, the Annual Election Period, the Medicare Advantage Open Enrollment Period, Special Election Periods, the Open Enrollment Period for Institutionalized Individuals, and in some cases, enrollment periods that apply only to Medicare cost plans. Each of these windows gives beneficiaries different opportunities to join, switch, or drop plans, depending on their eligibility and personal circumstances. The Initial Enrollment Period is the very first chance someone has to enroll. The Annual Election Period happens every year and gives all Medicare beneficiaries the chance to review their coverage and make changes for the upcoming plan year. The Medicare Advantage Open Enrollment Period allows current MA enrollees to make limited changes at the start of each year. Special election periods are reserved for specific life events, such as moving out of a plan's service area, losing other creditable coverage, or qualifying for programs like Medicaid or Extra Help. Individuals living in institutions have their own continuous open enrollment opportunity, allowing them to make coverage changes year-round. Once we understand when enrollment can occur, the next question is, who can actually complete the enrollment request? CMS allows the beneficiary to complete their own enrollment form, but certain others may complete it on their behalf when appropriate. Power of attorney agents, authorized representatives, and individuals acting under court order may legally submit an enrollment as long as they are acting in the enrollee's best interest. Enrollment requests may be submitted electronically, by phone, or on paper, as long as the request is captured accurately and the plan follows CMS guidelines for record-keeping. Some individuals can also be enrolled using a simplified opt-in process. This streamlined method is available in limited situations and allows a beneficiary to easily confirm they want to join a plan without going through a full application. Even with simplified enrollment, the individual must understand what they are agreeing to, and plans must document that the enrollee provided consent. Every enrollment must also include clear beneficiary acknowledgments. These acknowledgments make sure the individual understands how the plan works, including premiums, cost sharing, provider network rules, prescription drug requirements, and the fact that enrolling in a Medicare Advantage plan will typically replace original Medicare coverage. These acknowledgments protect both the beneficiary and CMS by confirming that the enrollee is making an informed choice. Part of enrollment guidance also involves understanding what plans are not allowed to do. Enrollment discrimination is strictly prohibited. Plans and agents cannot refuse enrollment based on health status, level of medical need, cost of treatment, or any other factor that would violate Medicare non-discrimination protections. Plans must accept any eligible beneficiary who applies during a valid enrollment period, unless CMS permits the plan to limit enrollment for very specific program reasons. After a beneficiary enrolls, a series of post-enrollment requirements begin. Plans must send required materials, such as confirmation of enrollment, a member identification card, and a comprehensive evidence of coverage document. The timing of when coverage begins depends on the specific enrollment period used. For example, enrollments during the annual election period typically begin on January 1st of the new plan year, while other enrollment periods may allow coverage to start the first day of the following month. Plans must follow CMS rules to communicate these start dates clearly to beneficiaries. Post-election rules also apply. Plans must keep accurate enrollment records, notify CMS of all enrollment transactions, and make sure beneficiaries receive their medications and medical services without delay. These protections help ensure a smooth transition for new members. Finally, we look at the disenrollment process. Disenrollment can be voluntary or involuntary. Voluntary disenrollment happens when a beneficiary chooses to leave a plan, usually during an eligible enrollment period or for reasons that trigger a special election period. Involuntary disenrollment occurs when a beneficiary loses eligibility, such as by moving out of the service area, failing to pay premiums after receiving proper notice, or engaging in behavior that seriously disrupts the plan's operations. Each disenrollment type has specific rules for notifications, deadlines, and effective dates of coverage. Overall, this module brings together the full picture of Medicare Advantage and Part D enrollment guidance. It explains when beneficiaries can make changes, who can submit enrollment requests, what happens after they join a plan, what protections they have, and how disenrollment works. This knowledge ensures beneficiaries are properly enrolled, fully informed, and protected throughout their Medicare journey. In this section, we're going to break down Medicare Advantage and Part D enrollment and election periods. These periods determine when a beneficiary is allowed to enroll in a plan, switch plans, or disenroll, and they are strictly regulated by CMS. Beneficiaries cannot simply enroll or change plans at any time they choose. Enrollment is only permitted during specific windows each year or during certain special circumstances. If a plan receives an enrollment request outside of a valid period, or if the application does not include the required information to justify the election period being used, the plan must follow up with the beneficiary to determine whether enrollment is actually permissible. Enrollment opportunities are organized into several key periods. These include the Medicare Advantage Initial Coverage Election Period, the Part D Initial Enrollment Period, the Annual Election Period, Special Enrollment Periods, the Open Enrollment Period for Institutionalized Individuals, and the Medicare Advantage Open Enrollment Period. Some of these periods are available to everyone at the same time each year, while others depend entirely on a beneficiary's personal circumstances. Some enrollment periods follow fixed calendar dates. The Annual Election Period, which runs every year from October 15th through December 7th, is available to all Medicare beneficiaries with eligibility for Medicare Advantage, or Part D. Another fixed window is the Medicare Advantage Open Enrollment Period, which runs from January 1st through March 31st. Other enrollment opportunities have more flexible timing. These include the initial enrollment periods that occur when a beneficiary is first eligible for Medicare, special enrollment periods that arise from specific life events or changes in circumstances, and the continuous open enrollment period available for individuals who reside in institutions. To get a clearer view, think of these enrollment windows as a roadmap, each serving a specific purpose. The initial enrollment periods help new beneficiaries get their coverage in place when they first qualify for Medicare. The annual election period gives everyone the opportunity to review and change their coverage for the upcoming year. The Medicare Advantage Open Enrollment Period allows certain mid-year adjustments for those already enrolled in a Medicare Advantage plan. Special enrollment periods apply only when specific qualifying events occur, and the Open Enrollment Period for Institutionalized Individuals remains open year-round. To summarize how these periods function, during the initial coverage election period and the Part D Initial Enrollment Period, beneficiaries can make their very first Medicare Advantage or Part D coverage decisions. During the annual election period, they can enroll in a plan, disenroll from a plan, switch plans, add drug coverage, or drop drug coverage. During the Medicare Advantage Open Enrollment Period, Beneficiaries enrolled in an MA or MAPD plan can switch to a different MA plan, switch between an MA plan with or without prescription drugs, or disenroll from Medicare Advantage and return to original Medicare. If they return to original Medicare during this time, they may also enroll in a standalone prescription drug plan. Special enrollment periods usually allow beneficiaries to enroll, disenroll, or change plans, although some SEPs limit the actions allowed. Institutionalized individuals have their own continuous enrollment flexibility, allowing them to enroll, disenroll, or switch plans at any time. Now let's take a closer look at the Medicare Advantage Initial Coverage Election Period, known as the ICEP. This is the time frame during which someone who is newly eligible for Medicare Advantage can make their first MA enrollment choice. The ICEP begins 3 months before the month a beneficiary is both entitled to Medicare Part A and enrolled in Part B for the first time. The period then ends either on the last day of the second month, after the month the individual is both entitled to Part A and enrolled in Part B, or on the last day of the person's Part B initial enrollment period, whichever is later. The Part B initial enrollment period lasts 7 months, beginning 3 months before the month the beneficiary meets eligibility requirements and ending 3 months after that month. During the ICEP, an eligible beneficiary may enroll in a Medicare Advantage plan. If their Part D initial enrollment period occurs during this same window, they can also choose an MAPD plan. A beneficiary can make only one enrollment choice during the ICEP, and once the enrollment becomes effective, the ICEP is considered used. However, individuals who enroll in an MA plan during their ICEP also receive an MA Open Enrollment period that starts the month they first have both Part A and Part B and continues through the last day of the third month of entitlement. During that MA-OEP, they may switch plans or return to original Medicare. An example helps illustrate how the ICEP works. Mr. Nash turned 65 in May of 2020. He became entitled to premium-free Part A, and he was eligible for Part B at that time. Because he had employer coverage, he chose not to enroll in Part B. He plans to retire in June of 2025 and will enroll in Part B effective July of that year. This means that his ICEP will run through the end of September 2025, giving him the opportunity to enroll in a Medicare Advantage plan during that time. Next, we look at the Part D Initial Enrollment Period, or IEP. This period begins 3 months before the month an individual is first entitled to Part A or enrolled in Part B, and it ends 3 months after the month of eligibility. If someone qualifies for Medicare because of disability before age 65, they will receive a new Part D IEP when they turn 65. During the IEP, a beneficiary may make one prescription drug coverage choice, including enrolling in an MAPD plan if they are eligible. When someone becomes eligible for both Part A and Part B at the same time, the MAICEP and Part D IEP occur together. If the beneficiary delays Part B enrollment until later, the ICEP and IEP occur at separate times. We now return to the annual election period, which runs from October 15th through December 7th each year. Every Medicare beneficiary who is eligible for Medicare Advantage or Part D may use this period to make coverage decisions. During the AEP, beneficiaries can enroll in an MA plan, an MAPD plan, or a standalone prescription drug plan. They can change from one MA plan or PDP to another. They can add or drop drug coverage or return to original Medicare. If a beneficiary wishes to keep their current plan, no action is required, although they should review any changes to benefits or formularies to ensure their current plan still meets their needs. Beneficiaries may submit multiple enrollment requests during the AEP, but only the last enrollment request received before December 7th will take effect. There are also strict rules governing how and when enrollment requests may be submitted during the AEP. Agents and brokers may not solicit or accept AEP enrollment forms before October 15th. Beneficiaries also cannot submit enrollment requests before the AEP begins. If a plan receives an unsolicited enrollment form from a beneficiary on or after October 1st, but before October 15th, the plan must hold the request and process it on the first day of the AEP. The beneficiary will receive an acknowledgement letter confirming that the plan has received the early submission. If a paper application is received before the AEP and includes evidence of agent or broker involvement, such as the agent's name or contact information, the plan must investigate the situation to ensure compliance with Medicare marketing rules. Now let's focus on the Medicare Advantage Open Enrollment Period, also known as the MA-OEP. This enrollment period is unique because it is only available to individuals who are already enrolled in a Medicare Advantage plan. Anyone who is not currently in an MA plan cannot use this period to join one, and they cannot use it to make changes to other types of coverage, such as cost plans, MSAS, or PACE. For beneficiaries who are enrolled in a Medicare Advantage plan as of January 1st, including those whose AEP election becomes effective on that date or those who simply renew their existing plan, the MA-OEP runs every year from January 1st through March 31st. During this window, eligible beneficiaries are allowed to make one single plan change. New Medicare beneficiaries have an additional version of the MA-OEP tied directly to their initial coverage election period. For these new enrollees, the MA-OEP begins in the first month. They have both Medicare Part A and Medicare Part B, and it continues through the last day of their third month of entitlement. This means that even though a new Medicare Advantage enrollee can make only one election during their ICEP, that rule does not prevent them from later making a change during their MA-OEP if they decide that a different plan is a better fit once their coverage begins. During the MA Open Enrollment Period, Medicare Advantage enrollees have several options. An MAPD enrollee may switch to another MAPD plan, change to an MA-only plan, or drop Medicare Advantage entirely and return to Original Medicare. If they leave an MAPD plan and return to Original Medicare, they can choose to add a standalone prescription drug plan because a coordinating Part D special enrollment period becomes available to match the effective date of the change. Individuals enrolled in MA-only plans have similar flexibility and may move to another MA-only plan, switch into an MAPD plan, or return to Original Medicare with or without enrolling in a PDP. It's important to remember that beneficiaries may make only one change during the MA-OEP. Once that change is submitted and processed, they cannot make another adjustment until a future valid enrollment period. CMS also places strict limitations on marketing during the MA Open Enrollment Period. Agents and marketing representatives are prohibited from targeting beneficiaries specifically because they are MA enrollees. They are not allowed to promote the MA-OEP, highlight the availability of this period in advertisements, or direct communications toward individuals who are known to be enrolled in Medicare Advantage. Beneficiaries can ask for information and receive help if they reach out on their own, but plans and agents cannot initiate OEP-related marketing. The MA Open Enrollment Period exists to give Medicare Advantage enrollees a safety net, an opportunity to correct a choice that doesn't meet their needs. But it is tightly regulated, limited to one change, and available only to those who are already enrolled in an MA plan. Now let's walk through the Medicare Advantage Open Enrollment Period, often referred to as the MA-OEP. This enrollment window is only available to individuals who are already enrolled in a Medicare Advantage plan. It is not available to people enrolled only in Original Medicare, nor is it available to people enrolled in cost plans, MSA plans, or PACE programs. For anyone who is enrolled in a Medicare Advantage plan on January 1st, whether they renewed their plan or their new plan became effective on January 1st through the annual election period, the Medicare Advantage Open Enrollment Period runs from January 1st through March 31st every year. This allows existing MA enrollees one opportunity to make a change if they discover that their current MA plan does not meet their needs. There is a second version of the MA-OEP that applies to new Medicare beneficiaries who choose an MA plan during their initial coverage election period. For these new beneficiaries, the MA-OEP begins the month they first have both Part A and Part B and continues through the last day of the third month of entitlement. Importantly, while individuals can make only one election during their ICEP, that rule does not limit their ability to make a change during the MA-OEP. They are still entitled to use the MA-OEP even if they already used their ICEP election. During the MA-OEP, an MAPD enrollee may switch to another MAPD plan, switch to an MA-only plan, or disenroll from Medicare Advantage entirely and return to Original Medicare, with or without enrolling in a standalone Part D plan. Likewise, an MA-only enrollee may switch to another MA-only plan, switch to an MAPD plan, or return to Original Medicare with or without a Part D plan. When someone disenrolls from an MAPD plan and returns to Original Medicare, a coordinating Part D special enrollment period is automatically available, so they may join a standalone prescription drug plan for the same effective date. Beneficiaries may only make one plan change during the MA-OEP. Once that change is processed, they cannot submit another MA-OEP request. As a reminder, because the MA-OEP is meant to be a beneficiary-driven period and not a sales-driven period, marketing rules are strict. Agents and brokers cannot create or distribute materials that reference the OEP or target individuals specifically because they are enrolled in a Medicare Advantage plan. Any marketing targeted to MA enrollees for the purpose of influencing plan changes during this period is prohibited. Next, we turn to Special Enrollment Periods, also known as SEPs. These enrollment opportunities are reserved for Medicare Advantage and Part D eligible beneficiaries who experience specific qualifying events that justify changing plans outside the standard election periods. SEPs also apply to individuals who wish to enroll in a 5-star plan when eligible. The timing for each SEP varies depending on the triggering event. Most SEPs end either when the new plan enrollment becomes effective or when the SEP timeframe itself expires, whichever comes first. For Medicare Advantage and Part D plans, SEPs are coordinated whenever appropriate, allowing beneficiaries to make both medical and prescription drug coverage changes in alignment. One of the most common SEPs occurs when a beneficiary permanently moves. If someone moves out of their plan's service area, or if they move to an area where they now have new plan options, they qualify for a relocation SEP. This SEP begins either at the time of the move, the month before the move if the beneficiary notifies their plan in advance, or when the individual is being disenrolled for being outside the service area beyond the allowable limits, 6 months for Medicare Advantage and 12 months for Part D, when the plan cannot confirm residency. This SEP ends 2 months after the month it begins, or 2 months after the month of the actual move, whichever is later. Beneficiaries using this SEP may select an effective date up to 3 months after the month their enrollment request is received, but the effective date cannot be earlier than the date of the permanent move. There are also SEPs tied to changes in Medicaid or low-income subsidy status. Anyone with Medicare Part A and/or Part B who gains or loses Medicaid eligibility, or who experiences changes in the level of assistance they receive, qualifies for a Medicaid LIS-CEP. During this CEP, beneficiaries with both Part A and Part B may enroll in or disenroll from a Medicare Advantage or Part D plan once. Beneficiaries with only Part B may make changes only to prescription drug plans. This SEP begins on the later of the date of the change or the date the beneficiary is notified of the change, and it continues for 3 months. Another common SEP applies to dual eligibles and individuals receiving any level of low-income subsidy, even if they are not on Medicaid. These individuals have a prescription drug-based SEP that allows them to make one PDP election per month with an effective date of the first day of the following month. However, this SEP cannot be used to enroll in or switch MAPD plans. Additionally, beneficiaries who have been identified as at risk or potential at risk due to suspected misuse of frequently abused drugs are not allowed to use this LIS dual eligible SEP. Once they receive their official written notice from the plan sponsor, they lose access to this monthly SEP until the at-risk designation is lifted. They may appeal the determination, and they retain access to all other Medicare enrollment periods, such as the AHIP and other applicable SEPs. Beyond these typical SEPs, beneficiaries may also qualify for several other situations, including Medigap-related SEPs, SEPs for severe or disabling chronic conditions that allow enrollment in a CSNP, SEPs for PACE, the 5-star SEP based on plan quality ratings, SEPs aligned with Medicaid enrollment processes, SEPs triggered when CMS or the state enrolls a beneficiary into a plan, SEPs related to the loss of special needs plan eligibility, SEPs for changes in employer or union coverage, and SEPs for the involuntary loss of creditable drug coverage. To illustrate how these SEPs work in real-life situations, consider a beneficiary like Ms. Osborne. She struggles with diabetes management. In June, her doctor recommends that she join a chronic condition special needs plan specifically designed for beneficiaries with diabetes. Because her condition qualifies her for a CSNP, she does not need to wait for the annual election period. She has a SEP that allows her to enroll immediately. Another example is Mr. Weir, who is 68 years old and still working. Although he pays for Part B, he uses his employer coverage as primary insurance and pays part of the premium. He recently learned that switching to a Medicare Advantage plan could save him money because the plan premium is lower than his share of his employer coverage. Because he is losing employer group coverage voluntarily, he qualifies for a SEP, allowing him to drop his employer plan and enroll in Medicare Advantage. There is also an important enrollment period specifically designed for individuals who reside in certain medical institutions. This is known as the Open Enrollment Period for Institutionalized Individuals, or OEPI. This enrollment flexibility applies to beneficiaries who move into, currently reside in, or are moving out of an institution such as a skilled nursing facility, rehabilitation hospital, intermediate care facility for individuals with intellectual disabilities, psychiatric hospital or unit, or long-term care hospital. The OEPI does not apply to individuals who simply meet an institutional level of care but do not reside in one of these facilities. For example, the OEPI does not apply to residents of assisted living facilities. The OEPI is unique because it functions as a continuous open enrollment period for as long as the beneficiary resides in the institution. Once the individual moves out of the institution, the OEPI continues for 2 additional months. During this window, beneficiaries may enroll in or disenroll from Medicare Advantage plans. switch plans an unlimited number of times, change or drop Part D coverage, or return to original Medicare. Although MA organizations are not required to accept OEPI enrollment requests, any plan that accepts one OEPI enrollment request must accept all OEPI enrollment requests. However, not every type of Medicare plan allows enrollment during this period. Individuals may not enroll in a Medicare Medical Savings Account plan during the OEPI. Enrollment in Medicare MSA plans is restricted to the initial coverage election period or the annual election period, except for the Employer Group Health Plan SEP, which includes employer-sponsored MSA plans. Disenrollment from an MSA plan is also limited to the AHIP or applicable SEPs, and the MA-OEP cannot be used to leave an MSA plan. If a beneficiary elects an MSA plan during the AHIP and has never been in an MSA plan before, they may revoke that election only up to December 15th of the same year. Cost plans also have their own enrollment rules. In general, cost plans must offer an annual open enrollment period of at least 30 days, and many cost plans allow enrollment year-round. If a cost plan includes an optional Part D benefit, beneficiaries may add that drug coverage only during valid Part D enrollment periods, and the cost plan must accept those Part D enrollment requests. A beneficiary who is currently enrolled in a Medicare Advantage plan must also have a valid period for disenrollment before switching from an MA plan to a cost plan. In this section, we're going to break down how Medicare Advantage and Part D enrollment requests work, the different formats plans are allowed to use, and the rules surrounding each method. By the end, you'll understand exactly how enrollment can be taken, what plans must offer, what beneficiaries must acknowledge, and who's legally allowed to complete an enrollment request. Let's begin with the general rules. During any valid enrollment or election period, plan sponsors are required to accept enrollment requests in whatever CMS-approved form they come in. That includes face-to-face interviews, mail, fax, or any other mechanism CMS has approved. Every plan must make a CMS-approved paper enrollment form available that matches the plan type, whether it's an MA plan, a Part D plan, an MAPD, an MSA, or a PFFS. Plans can also accept enrollment requests electronically or over the phone. Most enrollments must use the standard enrollment form, no matter how they're submitted. But there are two exceptions. A shortened enrollment form can be used when someone is simply switching between plans offered by the same parent organization, except for MSA plans. And a simplified opt-in enrollment process may be used for people new to Medicare who already have that organization's non-Medicare coverage, such as commercial insurance or Medicaid. Electronic enrollment has its own set of rules. Plans may create electronic enrollment options that work through an electronic device or a secure website. They can also lean on downstream entities, such as brokers or third-party websites for technology support, as long as the process is secure and approved. Plans may even accept enrollment requests by email, but only if the individual has already given consent to communicate through email when sharing enrollment information or protected health information. All electronic enrollment mechanisms must be fully approved by CMS, including all pages, materials, and images. Just like non-electronic formats, individuals must receive all required pre-enrollment information before submitting an online request. CMS also offers its own online enrollment option through Medicare.gov. However, CMS disables online enrollment for any MA or Part D plan that has a low performer icon, meaning the plan has received a star rating of fewer than 3 stars for 3 consecutive years. Telephone enrollment is also allowed, but the rules are specific. Plans may take telephonic enrollment only on incoming calls from individuals the plan does not already have an existing business relationship with. A business relationship exists when a person has already initiated contact, such as leaving a voicemail requesting a callback or submitting a business reply card. Plans may also accept enrollment during calls they initiate, but only if they are contacting someone with whom they already have a business relationship, and that person expresses a desire to enroll. All enrollment calls and all marketing calls must be recorded. If someone other than the beneficiary is completing the enrollment request, the call recording must capture their attestation that they are legally authorized under state law to enroll on the beneficiary's behalf, along with their full contact information. During the call, individuals must be clearly informed that they are completing an enrollment request, and the call must include the individual's agreement to be recorded. Telephonic enrollment must include every required element needed to complete the enrollment. If the situation qualifies for a short enrollment form, only the shorter list of required elements needs to be collected. The signature requirement is fulfilled through a verbal attestation indicating the beneficiary's intent to enroll. CMS also offers phone enrollment directly through 1-800-MEDICARE for additional beneficiary support. Another type of enrollment is the MA Opt-in Enrollment Request. This simplified method allows Medicare Advantage organizations to use information they already have from their non-Medicare business lines when enrolling someone into their MA plan. The plan still must collect any additional information it does not already have. This option is only available to individuals in their initial coverage election period, who are enrolled in a non-Medicare plan under the same parent organization and who have no break in coverage between their non-Medicare plan and the MA plan. MA organizations may contact members of their non-Medicare plans before or shortly after Medicare eligibility to offer this simplified enrollment method. The opt-in process may be completed using paper, telephone, or electronic methods, and when using phone or electronic enrollment, the plan may limit the collected information to only the items not already in its records. No matter which enrollment mechanism is used, certain acknowledgments from the beneficiary are required. The individual must acknowledge that they must maintain Medicare Part A and Part B to enroll in an MA plan, or at least Part A or Part B to enroll in a Part D plan. They must consent to the disclosure and exchange of information between HHS and the plan for purposes such as tracking enrollment. They must understand that enrolling in any other MA or Part D plan will automatically disenroll them from their current plan, except for plans like PFFS or MSA, which use modified language. Beneficiaries must attest that all information they provided is accurate and understand that intentionally falsifying information can result in disenrollment. They must acknowledge that their signature means they understand the enrollment request, and that any authorized representative acting on their behalf has appropriate legal authority. Finally, they must understand that benefits and services, other than hospice care and kidney acquisition costs for transplants, must be obtained through the plan to be covered by Medicare. Lastly, let's cover who is allowed to complete the enrollment request. Typically, only the Medicare beneficiary can execute their own enrollment or disenrollment from an MA plan. However, state law may allow certain individuals to act on behalf of the beneficiary. CMS permits this if the individual is legally authorized under state law, which may include court-appointed guardians, people with durable power of attorney for healthcare decisions, or individuals permitted to make healthcare decisions under state surrogate consent laws. Anyone completing an enrollment request on behalf of a beneficiary must attest that they are legally authorized to do so, sign the form, or identify their relationship to the beneficiary in electronic or telephonic formats, and provide full contact information. If there is any uncertainty about whether someone is allowed to sign for the beneficiary, agents must check with the plan sponsor. Before a Medicare beneficiary enrolls in a plan, the agent must make sure that all CMS-required pre-enrollment questions and topics are fully discussed. This conversation is essential because it ensures the beneficiary chooses a plan that truly fits their healthcare needs. The agent begins by confirming what type of health plan the beneficiary is looking for. Some people prefer a low premium with higher copays, while others prefer the opposite. The agent also needs to ask whether the beneficiary requires hearing, dental, or vision coverage, whether they rely on durable medical equipment, physical therapy, or other specific healthcare services, and if there are any additional needs, the plan must accommodate. Before enrollment, the agent must also confirm that the beneficiary's primary care physician and specialists are in the plan's network. If they are not, the agent must explain that the beneficiary would either need to choose new providers or be prepared to pay out of pocket. The same is true for hospitals or any preferred facilities the beneficiary wants to continue using. The agent must review how the plan handles out-of-network coverage and clearly explain that, except for emergency or urgent situations, services from out-of-network providers may not be covered. If the beneficiary is enrolling in a PPO or PFFS plan, the agent must review those out-of-network benefits as well. If the beneficiary wants Part D prescription drug coverage, the agent must review the plan's formulary to determine whether the beneficiary's medications are covered. If a medication is not on the formulary, the agent must explain the beneficiary may have to pay the full amount. The agent must also confirm whether the beneficiary's preferred pharmacy is in-network. If it isn't, the beneficiary will need to choose a new pharmacy. The agent must also review additional benefit information. This includes explaining whether the plan covers services outside of the United States and how enrolling in the plan might affect any other current coverage. Sometimes enrolling in a Medicare Advantage or Part D plan automatically disenrolls the beneficiary from other coverage, such as another MA plan or a Medigap policy. The agent must clarify that the plan is not simply a hearing, dental, or vision rider, but a full health plan that provides all Medicare-covered benefits. They must also explain that Medicare Advantage operates on a calendar year basis, meaning benefits may change every January 1st. Finally, they must remind the beneficiary that the evidence of coverage document outlines all the plan's rules, costs, and benefits. Cost discussions must also take place before enrollment. The agent must go over the plan premium, if there is one, and the beneficiary's Part B premium. If the beneficiary is comparing two plans, the agent must help them understand the difference in premiums. The agent must also review all cost-sharing requirements, including deductibles, copayments, coinsurance, primary care and specialist visits, inpatient hospital stays, and any other costs for services or items the beneficiary routinely uses. The agent must also discuss the plan's dental, vision, and hearing costs and any limitations. Before enrollment is finalized, beneficiaries must be told how to file a complaint with the plan. They also must hear about their right to cancel the enrollment and the deadline for doing so. For Medicare Medical Savings Account plans, the agent must explain the requirement to maintain a trust or custodial account. For special needs plans, the agent must clarify the eligibility criteria, such as meeting a chronic or disabling condition requirement for CSNPs, having Medicaid for DSNPs, or needing an institutional level of care for ISNPs. CMS also strictly prohibits enrollment discrimination. Marketing representatives are not allowed to deny or discourage enrollment based on a beneficiary's anticipated need for healthcare services, or because of race, ethnicity, national origin, religion, gender, sex, age, disability, health status, medical history, claims experience, genetic information, or insurability. They may not discriminate based on geographic location within the plan's service area. Representatives must follow all federal anti-discrimination requirements and cannot engage in practices such as targeting only high-income neighborhoods while ignoring low-income areas, or the reverse. Agents are also prohibited from asking health screening questions during the enrollment process unless the information is needed to determine eligibility for a special needs plan. Health assessment forms may only be sent after enrollment, never before. Once a Medicare Advantage or Part D plan receives a completed enrollment request, there are several required steps that must take place before the enrollee's coverage becomes effective. The first responsibility is to notify the beneficiary that the plan has received their enrollment request. This acknowledgement must include the effective date of their upcoming coverage and must be sent within 10 calendar days of receiving the completed enrollment request. If the beneficiary asks for a copy of their paper enrollment form, the plan must provide it. And for enrollments submitted online or over the phone, the individual must receive proof that their request was received, such as a confirmation number. The plan must also supply proof of health insurance coverage, so the member can begin using services on their effective date, including all information necessary to access benefits. If the beneficiary requests to have their plan premiums withheld by the Social Security Administration or the Railroad Retirement Board, the plan must explain how this process works. The beneficiary needs to understand that SSA or RRB premium withholding typically begins 1 to 2 months after approval, and that withholding is never retroactive. This means the enrollee is responsible for paying the plan directly for any premiums owed between the coverage effective date and the month withholding begins. If those premiums are not paid, the plan can disenroll the member. Once CMS notifies the plan whether the enrollment has been accepted or denied, the plan must send written notice of CMS's decision to the beneficiary within 10 calendar days. Regardless of how the enrollment request was submitted, the plan sponsor must provide important information about being a member of the plan before coverage begins. This includes explaining all costs the beneficiary will be responsible for, such as monthly premiums, any late enrollment penalties, deductibles, coinsurance, and copayments. The plan must also explain that the beneficiary authorizes necessary data sharing between the plan and CMS and must discuss the financial liability the individual may face if it is later determined that they were not entitled to Medicare Part A and Part B at the time coverage began, but still used plan services. The plan must also provide the beneficiary with the effective date of their coverage and explain how to access services if the ID card has not yet been received. Medicare Advantage organizations must also obtain an acknowledgement that the beneficiary understands they are expected to use designated network providers, except for emergencies, urgently needed care, out-of-area dialysis, and situations where the plan authorizes out-of-network care. There are situations in which a plan cannot provide all required materials before the effective date, usually when an enrollment request is received in the final days of the month and coverage begins on the first of the next month. When this happens, the plan must still send all required materials no later than 10 calendar days after receiving the completed enrollment request. Coverage always begins according to the rules of the election period used for the enrollment. If the enrollment occurs during the initial coverage election period or the initial enrollment period for Part D, coverage begins the first day of the month of entitlement to Medicare Parts A and B, or the first day of the month following the enrollment request if it is submitted after entitlement begins. Enrollments during the annual election period become effective January 1st of the following year. Enrollments during the Open Enrollment Period for Institutionalized Individuals, The Medicare Advantage Open Enrollment Period, or most special election periods, begin on the first day of the month after the plan receives the request, unless the SEP has an exception. If a plan sponsor determines that a beneficiary qualifies for more than one election period, the individual must be allowed to choose their preferred effective date, as long as the date aligns with the rules of the available election period. The plan must attempt to contact the beneficiary to confirm their choice and must document all attempts. If the plan cannot reach the beneficiary, it must assign the effective date based on the regulatory ranking of election periods. When a beneficiary qualifies for an employer group health plan special election period and another election period, and the enrollment is made through the employer or union, the effective date will follow the EGHP SEP unless the beneficiary requests another allowable date. If one of the available election periods is the ICEP, the plan cannot assign or allow an effective date that occurs before the month the individual is entitled to both Medicare Part A and Part B. Disenrollment from Medicare Advantage, Part D, or cost plans can be voluntary or involuntary. Voluntary disenrollment occurs when a beneficiary chooses to leave a plan. Involuntary disenrollment happens when the plan or CMS requires ending the membership due to specific circumstances. Plan representatives may not encourage disenrollment except in CMS-authorized situations. Beneficiaries may voluntarily disenroll during a valid election period by enrolling in another plan, submitting a written request, using an online submission if available, or calling 1-800-MEDICARE. Certain plans, such as MSAs or employer-sponsored plans, have specific disenrollment methods. Cost plan enrollees may disenroll at any time with a written request, but cannot do so by calling Medicare. Required involuntary disenrollment occurs when an enrollee becomes ineligible, such as moving out of the service area, losing Part A or Part B coverage, losing special needs plan eligibility, or no longer meeting MSA criteria. Other triggers include death, plan termination, non-payment of required Part D IRMA, or lack of lawful presence in the U.S. When an enrollee moves out of a plan's service area, MA organizations must disenroll them if they are gone for more than 6 months, unless the plan offers an extended visitor or traveler benefit. Part D sponsors must disenroll after 12 months if they cannot confirm the enrollee's residency. Optional involuntary disenrollment may occur if a beneficiary fails to pay premiums, engages in disruptive behavior, provides fraudulent information, or allows another person to use their enrollment card. Plans must apply these policies consistently. MAPD and MA-only plans may retain dual-eligible members who fail to pay premiums, and Part D plans may retain low-income subsidy beneficiaries. For failure to pay premiums, the plan must notify the enrollee in writing, provide a minimum 2-month grace period, and allow reinstatement for good cause under certain conditions. Enrollees retain the right to file complaints if their membership ends. As we wrap up, let's review the key points you need to know about Medicare enrollment and related processes. First, understanding election periods is critical. The Initial Coverage Election Period, or ICEP, applies to new Medicare beneficiaries and determines when coverage begins. The Annual Election Period, or AEP, runs from October 15th to December 7th each year, letting beneficiaries make changes to their Medicare Advantage or Part D plans for the following year. The Medicare Advantage Open Enrollment Period, or MA-OEP, is only for current MA enrollees and runs from January 1st to March 31st, allowing plan switches or a move back to original Medicare. Special election periods, or SEPs, exist for individuals with qualifying life events, such as moving, gaining, or losing Medicaid or low-income subsidy status, or enrolling in a 5-star plan. Institutionalized beneficiaries have their own continuous open enrollment period for institutionalized individuals, allowing unlimited MA or Part D enrollment or disenrollment while in the facility. Next, enrollment requests can be submitted in multiple ways: paper forms, electronically, or by phone. Plans must accept all CMS-approved enrollment requests during valid periods. Simplified methods, such as the opt-in process, exist for new Medicare beneficiaries already enrolled in the plan sponsor's non-Medicare coverage. All enrollments must ensure beneficiary acknowledgments, including understanding plan rules, costs, network restrictions, and consent for information exchange with CMS. Beneficiaries must also receive pre-enrollment information. Agents are required to discuss network providers, out-of-network coverage, prescription drug coverage, costs, and any special considerations like chronic conditions or eligibility for special needs plans. Marketing representatives are strictly prohibited from discriminatory practices, from asking unnecessary health screening questions, or discouraging enrollment based on health status, geography, or demographic factors. After enrollment, plans must notify beneficiaries prior to the effective date. This includes confirmation of enrollment, coverage effective date, any premium withholding information, and instructions for accessing services before the ID card arrives. Effective dates vary by election period, but generally coverage begins the first of the month following the plan's receipt of the enrollment request. When beneficiaries are eligible for multiple election periods, they may choose their effective date within the rules of ICEP or other applicable periods. Finally, let's cover disenrollment. Beneficiaries may voluntarily disenroll during a valid election period by enrolling in another plan, submitting a written request, using an online submission if available, or calling 1-800-MEDICARE. Involuntary disenrollment occurs when a beneficiary becomes ineligible due to a change in residence, loss of Medicare, or special needs status, death, or non-payment of required premiums. Optional involuntary disenrollment can occur for non-payment of plan premiums, disruptive behavior, or fraudulent information, but plans must apply these policies consistently and protect the rights of dual-eligible and low-income subsidy members. By understanding these election periods, enrollment methods, pre-enrollment requirements, post-enrollment notifications, and rules for disenrollment, you'll be well-equipped to navigate the Medicare system. Whether you're advising clients, taking the AHIP exam, or managing your own coverage,